Hi guys, welcome back to the Stroke Recovery channel where we talk about everything stroke. I'm sorry if the lighting's really bad in this video, we have no power at the moment so you mightn't be able to see me too well. Today I wanted to talk about medication after stroke. Obviously I can't give you any medical advice on what you should be on. All I can tell you is what I'm on and what's worked for me post-stroke. So prior to the stroke I didn't take any medication at all. I rarely got headaches, so I rarely had a problem. But post-stroke, I'm on 4 main drugs. Obviously the most important one is a blood thinner. Now, immediately after the stroke, because my carotid artery tore open, they put me on clopidogrel or Plavix. I think it was 75 milligrams daily as a blood thinner. I was then taken off that after about 3 years of not having another stroke, which was really good because now I'm on low-dose aspirin. Now, low-dose aspirin in Australia is 100 milligrams. In other countries, it's 81 milligrams. I'm not sure why. I did ask my neurologist about blood thinners and what's the best for me. He explained that clopidogrel or Plavix he prescribes for 2 or more strokes. If he's worried you're going to have another stroke, he'll put you on clopidogrel. But if you've only had one and it's not likely to happen again, he'll put you on low-dose aspirin. As the cause of my stroke was a carotid dissection, which is quite rare, it's not likely that I'll have another stroke, so low-dose aspirin's fine. The next drug you'd be put on after a stroke is a statin, which is a cholesterol-lowering drug. It will drastically lower the risk of you having a second stroke if it was related to cholesterol in the first place. People with atrial fibrillation may be familiar with clopidogrel or warfarin. Some people have had strokes from undiagnosed atrial fibrillation or undiagnosed type 2 diabetes. So the third drug I was put on was an antidepressant, which was sertraline or Zoloft. I went from 50 milligrams daily to 200 milligrams daily, and I changed after I felt it wasn't working for me anymore. I got changed to Prozac or fluoxetine 20 milligrams a day for my mood, and it seems to keep me on a really good level. Keeps me pretty happy every day. I did go to 40 milligrams for a while there, but was having some issues with feelings. I felt like I didn't feel anything, and my doctor put me back down to 20 milligrams, which is perfect for me. I do recommend that you do go on an antidepressant after stroke because studies have shown that it benefits neuroplasticity, so that's a good reason right there. It'll also keep your spirits up during rehabilitation. I was against antidepressants prior to the stroke. I just thought that we don't need them. You should be happy anyway. I was always pretty happy. But after the stroke, my mind has changed. I feel like if you need them, have them. You know, if life can be better, then take it. The fourth drug I was put on is called lamotrigine, which is an anti-seizure epileptic drug. I didn't have the standard epilepsy with the tonic-clonic seizures. My seizures looked like a recurring stroke. So I would be sitting there at home and the left side of my face would droop down. My left arm and left leg would go weak and my speech would be slurred, and I'd get an ambulance back to hospital, and they'd found out that I was just having seizures, so I was put on lamotrigine, 25 milligrams a day. After about a year, I didn't have a seizure, so my doctor took me off lamotrigine 25 milligrams a day. After I'd been taken off lamotrigine, roughly about a week after it, funny things started to happen. The spasticity in my left leg and hand, and particularly arm, got really bad to the point where I could barely use them. Like, I had full movement in my hand, and after not having lamotrigine, I couldn't close it past there. So I went back to my doctor and I said, I've gone off this medication last week, this is happening. So I went back on lamotrigine, but 100 milligrams a day, and spasticity has been really good. I still haven't got full strength, but I can use it and do everything I want. So lamotrigine has really helped with spasticity. There's no indication that it does help with spasticity, but I know in my personal experience that it really does. I've tried Baclofen, that worked also. Some people have Baclofen pumps if they have really bad spasticity. I didn't want to go down the road with the Baclofen pump. My spasticity wasn't that bad, And I've found that just taking lamotrigine and doing exercises daily, my arm is nearly normal. Not as strong as it was prior to the stroke, but it's nearly normal. I can even start to play guitar now. So they're the 4 main drugs I've been put on since the stroke. I doubt they'll change probably ever again. I'll take at least statin and aspirin for the rest of my life to stop any more blood clots. The main reason I went on atorvastatin was because I had a carotid artery dissection and some fat can build up in the tear in the artery, and also where the clot was in my middle cerebral artery right here, it's narrowed it because of the blood clot's done some damage, so they don't want any fat building up there, so the atorvastatin cleans all that out of the way. The low dose aspirin I take is called Cartia. They said that's the best one, and it's gentle on your stomach too if you're taking it daily. You will be told to steer clear of drugs like Nurofen, non-steroidal anti-inflammatories, because they can affect your blood clotting, so steer clear of them. I've had to take oxycodone or endone a few times for migraines post-stroke, and I've found that my spasticity went really bad, so I steer clear of them too. I am trying to smile more in these videos. I've been told I don't smile enough. My smile is a little bit strokey. If you look at it, it does kind of sit down a little on the left, so I don't love my smile. Thank you to all that emailed me at strokerecoveryvideo@gmail. I'm happy to answer any questions. Any questions you have about my recovery, either leave them in the comments section or email me directly. I'll get back to you as soon as I can. Thank you to everyone that shared and subscribed these videos. That's really helped me get the channel off the ground, to help as many people as I can. Thanks guys, bye.